Hey, I'm Haley, and I'm going to provide you with more information about spina bifida. It is a birth defect that involves incomplete closure of the embryonic neural tube, which is an incomplete formed spinal cord. The vertebrae is supposed to form over the spinal cord in the part that is open, but it doesn't grow together. There could be a sac filled with fluid that inhabits around the open area. I'm not sure how to say this word, but my meningocele is it's the most extreme type of spina bifida because it's mainly the one that causes the disability. Surgery is an option, but the nerve damage is permanent, and there's no way to get it back, and the normal function in the affected part of the spinal cord cannot be restored. A person with spina bifida will always have dysfunction of the spinal cord and nerves from where the opening starts and below. The symptoms of spina bifida are created by the lumbar and the sacral areas of the spinal cord, and the lumbar nerves control like the muscles in the feet, the hips, the knees, and the legs, and they help the body stay upright, erect, like where you can sit up. And the sacral nerves control the bowels and the bladder. And if these nerves are damaged, a person may experience like being paralyzed or loss of the sensation of their skin, uncontrollable bowels and bladder, and spinal curvature. According to the Spina Bifida Association of America, the people with spina bifida have an allergy to latex, so you can imagine how hard it would be to go to the hospital with latex gloves and all that. They have to arrange for you to be there. And the causes of spina bifida are usually developed before the mother even knows she's pregnant, like within the first 28 days. And medications and diabetes and obesity and increased body temperature are predicted to increase chances of having a child with spina bifida. But however, like research has shown that most women that have children with spina bifida do not have these symptoms or factors. Research also shows that it is probably a genetic cause, and it results from the interaction of multiple genes, and also caused by environmental factors. The amount of folic acid is also a contributing factor in the development of spina bifida. To prevent spina bifida, a woman can, the only way to prevent spina bifida is for a mother to have high levels of folic acid before and during pregnancy. Like cereals and grains in the U.S. are filled with folic acid, and green leafy vegetables like broccoli, spinach, dark lettuce, egg yolks, beans, whole grains, orange juice, and citrus fruits are all great sources of folic acids. Even if you're not planning on being getting pregnant, having kids, it's always recommended for you to take folic acid supplements, because over half of the pregnancies in the U.S. are unplanned. Treatment for spina bifida, well, there's no cure for nerve damage caused by spina bifida, but to prevent more nerve damage, surgery is performed to close the opening in the back. A shunt can also be installed to drain the fluid that is produced by the brain. And periodic evaluations by doctors will always have to be performed throughout the life of someone with spina bifida to observe the neurological and the nerves in the body. And people with spina bifida, they'll need braces, crutches, wheelchairs, other mobility assistance. And the people may need catheterization or some sort of bowel management program. It depends. From my personal experience, I have an aunt that has spina bifida, and she was able to walk a little whenever she was younger, and then she eventually had to have braces and then crutches, and then after she was able to get pregnant, she has a son, and she is confined to a wheelchair. She's lost all sensation of her legs. She can't feel anything on her legs, and it's very hard for her, but she has so many blessings of life, and she has 2 beautiful grandkids, and there are many blessings to come with someone with spina bifida. Support groups you can go to www.spinabifidasupport.com or www.familyvillage.wisc.edu. Thank you.